They say the journey matters at least as much as the destination. Does this apply to universal health coverage? Come on board and find out for the launch of the UHC Global Monitoring Report 2019. 4 years ago at the United Nations, world leaders committed to the Sustainable Development Goals, the SDGs. They pledged to advance their population's economic, social, and human development and health. SDG 3 targets health. It aims at enabling everyone to access the care they need, whenever they need it, wherever they are. This is what we call universal health coverage, and UHC means leaving no one behind. To progress towards UHC, it is crucial to set the course to avoid getting lost, and to check we're going in the right direction. The latest UHC Global Monitoring Report does just that. It is a precise navigation instrument to ensure the course is right. So, how are we doing? The good news is, service coverage improved from 2000 to 2017 thanks largely to interventions targeting infectious diseases and maternal and child care. But globally and for many countries, the pace of progress has slowed since 2010, and the poorest and most fragile countries still lag behind. Put bluntly, progress is too slow, and we need to accelerate to reach the SDG target by 2030. To correct the course, we need to see additional investments in primary health care as the main channel to deliver UHC. If progress is not at least doubled, people will continue to miss out on the health services they need by 2030. How are we doing on out-of-pocket spending? Well, the gains in service coverage have come at a major cost to individuals and their families. Millions of people are still spending too much of their household budget on health and are falling into poverty as a result. The targets can be achieved mainly through increased and more efficient use of domestic funding, as well as better targeted aid whenever necessary. To use PHC as a catalytic investment for UHC requires an additional investment of $200 billion per year and will save 60 million lives. How can we address these daunting challenges? We need to invest in health systems. Another consideration to keep in mind, gender inequality is present across the health sector. Risks are different, and so is care-seeking behavior. Besides, women, who are usually the primary caregivers, make up 70% of health and social workers, but are paid less than men and have fewer leadership roles in health. While in some areas the path seems clear, in other areas the horizon still looks distant and blurry. It is still possible to achieve UHC by 2030, but will require accelerated efforts. All hands on deck! All countries can kickstart their efforts with an immediate 1% allocation of GDP to primary health care. More than ever, the leadership of policymakers is necessary, as after all, UHC is a matter of political choice. There is not much time for such an arduous journey. Every step counts. Together, let us make UHC a reality.